1 in 5 doctors who have long COVID have been forced to stop working or cut back their hours. We're going to have a look at this with a bit more detail with Sky News. Let's go, guys. Good morning, good afternoon, good evening, guys, wherever you are in the world. This is REGANELITE here with an article from Sky News, and the headline is 1 in 5 doctors with long COVID forced to stop working or cut back hours. A GP had told Sky News how she lost her job and she thought she was going to lose her house after the conditions caused her to take 6 months off work. Now, we knew that when COVID happened, obviously we were not fully prepared for it, and clearly this is just one doctor's story, and they were in circumstances beyond their control. I've mentioned about how people find themselves in circumstances beyond their control and they end up losing everything because of it, at no fault of their own, and because there's not the systems or the people or the available to help them when these kind of things arise. So this is just another example of failure, of abject failure from our government. It's easy to say that they weren't prepared and all that kind of stuff, but you know, we know the story about the austerity, we know about the cuts to the NHS, we know about all these kind of things. It has been an abject failure of the government on this, but let's read into it. So doctors who have contracted COVID-19 on the front line are still living with the ongoing symptoms of the virus, have been left in financial limbo if they struggle to return to work. The British Medical Association, the BMA, found 1 in 5 doctors with long COVID have been forced to stop working or significantly cut back on their hours. Dr. Amy Small had been a GP partner in Edinburgh. She contracted COVID-19 in April 2020, but her symptoms persisted and snowballed. Dr. Small told Sky News, "In the first 6 months to a year and a half, daily I had awful fatigue to the point I couldn't eat because my jaw was too sore because chewing made my muscles hurt. I have headaches and I have a daily fever for 7 months. I still get fever very easily if my kids catch colds. I have tonsillitis. I've had awful aches and pains in my body. I was so breathless I couldn't walk up the stairs without stopping once or twice a month." After 6 months off work, she eventually lost her job because the condition left her unable to keep up. So, no fault of her own, guys. Because of her condition, she was let go. And yeah, it's just it's not right. I mean, something, anything, some kind of alternative, but it was devastating. My husband also had long COVID. Both had long COVID. At the time I lost my job, his pay was halving, my roof was leaking, I had to pay for a kid in full-time nursing, and we risked losing everything at that point. I thought we were going to lose our house. We were really facing really challenging times. The British Medical Association surveys some 600 doctors, with 48% saying that they've experienced loss of earnings as a result of long COVID symptoms. The BMA said those medical need support when they recover. Professor Tim Strain, chair of the BMA Course Board of Science, told Sky News that we cannot afford to have fully trained, very able staff not being able to do their job they've been trained for at this moment. It's a disaster for the health service and it's very short-staffed already. There are many doctors who are actually retired on health grounds and feel they're not able to work at all, and that in order to be able to get back to work going forward they need to be given additional support. But there are many others who are way too young, have a retirement plan in place and are too unwell to return. They need to be given the financial support to allow them to focus on getting better whilst they're in this position." Yeah, exactly. If you can't just cut their legs off. They need that financial support when they're in this situation and not just left out in the cold. Dr. Small moved to Sheffield, where she now works as a part-time GP and for a charity. She said she's in a considerable better state when she first contracted the virus, but still had some health comparisons. The symptoms were endless like many others, and it come back now and again. Dr. Small said this is far from an issue of the past. Long COVID continues to take so much from so many. So many of us are still ill. Many of us have lost our jobs and their houses and their livelihoods. It's not likely to get back anytime soon, as it isn't a past problem. It's a very live problem which is going to have ongoing consequences for many years. The Department of Health and Social Care spokesman told Sky News long COVID can have a debilitating impact And we are backing our world-leading scientists with over 50 million to better understand the long-term effects of this virus and make treatment available. NHS staff are able to seek support for long COVID from their GP or one of the 100 online specialist clinics available nationwide. The NHS has also committed 324 million to support people with ongoing symptoms of long COVID. The same rhetoric from the Department of Healthcare. You know, we've thrown money investment in. They can speak to a specialist, all that kind of stuff. No clear plan whatsoever from them. It's pretty despicable, really. No real plan again, guys. It's so frustrating. There needs to be more done. I'm pretty sure I've said this before about more needs to be done, and it's frustrating that these people are in this position at no fault of their own, and because of COVID, and they're not getting the financial support they need and be given the help and assistance that they need to get through it. But it appears that's not going to be the case. What do you guys think? What could the government be doing? What should Labour do when they go in government? What should their plan be to help dealing with this? Interested to know what you guys think. Like, share and subscribe. Thank you very much for watching, guys, and I will catch you all very, very soon.